Today, we're going to talk about a journey that millions of people around the world experience, the journey of cancer. We'll cover it all, from the moment of diagnosis all the way through recovery. But this isn't just a story about medicine. It's really a story about science, the human body, and the incredible challenge of putting a life back together after the fight is over. So let's start with a big question, one that's going to frame everything we talk about today. What does it truly mean to beat cancer? As you're about to see, the answer goes way, way beyond the walls of a hospital.
Okay, let's dive right in. To really understand the journey, you first have to understand the opponent. And believe it or not, it all starts with a single cell that decides to go rogue. Think about it. Our bodies are made of trillions of cells, and almost all the time they follow a very strict set of rules for growing and dividing. It's a beautifully organized system. But what happens when some of those cells just stop following the rules? Well, that's where we get our clinical definition. Cancer is basically an abnormal growth of cells. These cells start to proliferate, which is just a fancy word for multiply, in a totally uncontrolled way. And here's the really crucial part. They can sometimes spread or metastasize to completely different parts of the body. In this image right here, this gives you an idea of what that chaos looks like up close, on a microscopic level. You know, the thing to remember is that these aren't foreign invaders like a bacteria or a virus. And that's the really frightening part. Cancer is our own body cells just gone haywire. So once cancer is identified, the very next step is to figure out its scope. You have to understand exactly what you're dealing with. This whole process is about creating a detailed battle plan. Just think of it this way. To fight any enemy, you need to know two things, right? Its strength and its location. It's the exact same idea in medicine, and this critical step is called staging. Now, to make sense of it all, oncologists use this really smart, standardized method called the TNM system. It's basically a three-part assessment. T stands for the size of the original tumor, N checks to see if it has reached the nearby lymph nodes, and M stands for metastasis, which answers the most important question of all, has the cancer spread? Let's use breast cancer as an example to see how this works. Now, I know this diagram looks a little complex, but the most important part is right there at the top. The very first thing doctors need to figure out is if the cancer is in situ, meaning it's contained right where it started, or if it's invasive, which means it has started to break out into the surrounding tissue. That one distinction is absolutely critical. It changes the entire treatment plan. And that brings us to the treatments themselves. Once that battle plan is in place, it's time to bring out the weapons. And, modern medicine has developed a pretty powerful arsenal to fight this disease.
The main weapons generally fall into these four categories. You've got surgery, which is the most direct approach, physically cutting out the tumors. Then there's chemotherapy, which uses powerful drugs to fight cancer cells all over the body. Radiation therapy is more of a targeted strike, using high-energy rays. And then there's the newer kid on the block, immunotherapy, which brilliantly turns your own immune system into a cancer-fighting machine. So let's zoom in on surgery for a second, using that breast cancer example again. You can see two common approaches here. A simple mastectomy involves removing the entire breast and some lymph nodes. The modified radical mastectomy is a bit more extensive. It removes the breast and all the lymph nodes in the armpit area, but it makes a point to preserve the chest muscles underneath. Chemotherapy, on the other hand, is a totally different beast. It's not a targeted strike. It's a system-wide attack. Its drugs are designed to hunt down and kill any rapidly dividing cells. Now, the key here is that this includes cancer cells, but it also includes a lot of healthy, fast-growing cells, like the ones in your hair follicles or your digestive system. And that right there is why it has such widespread side effects. And then you have radiation therapy. Now, in total contrast to chemo, this is a targeted strike. It's like a sniper. It uses high-energy rays to damage and kill cancer cells in one very specific, localized spot. But as you can imagine, fighting this battle takes a serious toll. These treatments are absolutely life-saving, but they come with huge challenges, both for the body and the mind. So, for instance, you might hear a doctor use a very clinical-sounding term like peripheral neuropathy. It sounds pretty medical and distant, right? But what does that actually feel like? What's the lived experience behind those words? Well, it's when the nerve damage from chemo is so bad that a simple, everyday act like buttoning your own shirt can feel like a monumental, almost impossible task. That's the reality. And that is just one example of the huge burden the body carries. It's this immense, heavy weight.
You've got the physical tolls like alopecia, that's hair loss, and a kind of severe, crushing fatigue that's hard to describe. But then you also have the emotional burdens, like intense anxiety and fear, and just the sheer psychological weight of it all. It really, truly affects every single part of a person's life.
And this is exactly why the journey doesn't just stop when the treatment does, not by a long shot. The next chapter, Rehabilitation and Recovery, is all about actively, purposefully reclaiming your life and your abilities. And this is such a critical point from the source material. It notes that so often, the needs go unmet, especially for people whose jobs and ability to work have been turned upside down by cancer. This points to a huge gap in care that we're only now starting to really address. This is where a field like occupational therapy becomes absolutely essential. Now, the name can be a little confusing. Occupation here doesn't just mean your 9-to-5 job. It's a type of therapy that's focused on helping people regain the skills they need for all the occupations of daily living. You know, everything from getting yourself dressed to making a meal.
And the help they provide is incredibly practical. It's not just about what happens after everything is over. Therapists actually educate patients before a surgery so they know what to expect. They help people manage that bone-deep fatigue, retrain those fine motor skills we talked about, and help them regain strength after maybe being in bed for a long, long time. And all of this brings us right back to that question we started with. Is beating cancer just about the absence of disease, or is it about reclaiming the ability to live a full, meaningful life? I think, as the vital work of rehabilitation shows, the answer is pretty clear. True recovery. That's about rebuilding a life one day, one small victory at a time.